Hi, I'm Dr. Charles Powell with the Specialty Clinic of Smart UU, a Department of Healthcare Associates of Texas. Today I'm here to talk to you about sleep apnea and a new revolutionary new treatment for sleep apnea that we do here and that we've developed especially for our patients that suffer from this. A little bit of background on sleep apnea will probably catch your interest, and that's the fact that we suspect that almost 28% of Americans deal with this disorder. Obstructive sleep apnea is a process of the airway closing down and causing people to stop breathing at night. At first, it might seem rather benign. People are waking up a little more tired than they usually are. They have to take naps during the day, but then it leads to problems with memory and concentration. And here's the real kicker. Later in life, they start developing problems with hypertension, heart disease, diabetes. In fact, having untreated obstructive sleep apnea puts you at a 6-fold increased risk of heart attack, a 5-fold increased risk of stroke, an 8-fold increased risk of dementia, a 10-fold increased risk of congestive heart failure, just to name a few. So it's not just about the right here, right now that we're worried about. Yes, we want people to feel better, to feel more focused, to have attention, to wake up feeling like they actually got a good night's rest. But we also are worried about the long-term complications associated with it. Now, it's really important for me to have our patients understand what is obstructive sleep apnea, what's going on. Well, another little interesting factoid is that the people that have obstructive sleep apnea that we see here in the clinic, only about 5% of people with sleep apnea have actually been diagnosed. If you're watching this video, you've probably either been diagnosed or you strongly suspect you have it. The problem is that the majority of people that have it have no clue. Let's take a look real quick though at what's going on in obstructive sleep apnea. If you take a look at just the anatomy of the airway, what you have here is basically your windpipe that goes down into your lungs, and you have your tongue, you have your soft palate, and of course the nasal area. The true problem that occurs in obstructive sleep apnea is usually going to be right here at the level of the tongue. The vast majority of cases of obstructive sleep apnea occur because the airway at this level obstructs. When you go to sleep at night, it's not just on and off. What I mean is there's different stages of off or being asleep. You initially go to sleep and you go through upper levels of sleep and then deeper and deeper sleep, sometimes going into REM sleep where you dream, and then eventually into stage 4 sleep where you get deep, restful sleep. That's where you recharge your batteries. So many people go to sleep at night thinking that, hey, I slept from this point to this point, that should have been 7 to 8 hours, it should be fine. But if you're not getting truly down into deeper levels of stage 4 sleep, you're not doing yourself much justice. You're not recharging your batteries. The problem is that when you enter stage 4 sleep, that's when your body really relaxes in REM and stage 4 sleep, and that's when the airway obstructs. Basically, the tongue falls back into the throat, causing obstruction in the airway. Now, a partial obstruction might present as snoring. We've all heard that at times, but true obstructive airway in OSA comes from the tongue collapsing so far back that air can't move at all. We've all probably heard that family member who has the really long pause in their snoring, and then all of a sudden the catch-up breath as they catch up and start breathing again. The problem is what the body has to go through in order to cause itself to wake up, the kicking of the adrenaline and other body systems to try to save its life. It's hard on the body, creates a lot of inflammatory and oxidative damage, and therefore leads to all kinds of those health problems that we discussed a little bit earlier. Now, there is a certain amount of time where the soft palate, where if you trace your tongue up the roof of your mouth towards the soft fleshy part in the back, there are times where the soft palate can actually be part of the apnea process as well. Sometimes we will target treatment here, but the majority of the time we really target the tongue, at least with what we do here at Smart UU. Now, I wouldn't be doing justice if I didn't go through several different treatment options for sleep apnea. One of the knee-jerk reflex and what some people have called the gold standard of treatment for sleep apnea has really been centered around the CPAP device. Now, I'm sure either you've seen one at this point if you're seeing this video, or you've probably had a family member or somebody that has it. These are the big face masks that people wear. Sometimes they're smaller these days with nasal pillows and various other devices that basically strap onto the patient at nighttime, connected to a long tube to the nightstand where basically pressure is generated with air into the patient's airway. Now here's the concept. Basically this mask on the airway allows for positive pressure to be forced into the airway. Here's what I like about CPAP. It doesn't matter what level in the airway your obstruction is. It could be in the nose, soft palate, and the tongue. It's going to treat all levels by putting that positive pressure in to open it up. The problem's tolerance. Some studies have showed that at the end of 1 year, up to 60% of people have discontinued their use of their CPAP device and don't even know where the machine is because their spouse got tired of seeing it on the nightstand and eventually just put it in the closet. At the end of second year, there have been some studies that show a discontinue rate as high as 80%. So here you have a disease state that's unchecked. You have what a lot of people consider the gold standard with a CPAP device that most can't tolerate, but yet we continue to prescribe it. Well, the main reason for that is that we just haven't had much else that was good. With my other partners, I like to use the example of, if we had a new antibiotic that only worked 25% of the time, would you prescribe it? Most of them will tell you no. But I told them if that was the only antibiotic you had, would you use it? And that's usually what it comes down to. And that's where CPAP has fit into the equation for a lot of patients. There just haven't been many options, but now we've got better ones. Let's look at a few. One of the ones that a lot of people will go to is an oral device. I want to explain how they work, and I want to use some caution with them as well, because an oral device has to be fit by a specialist that deals with oral devices. A lot of practices have bolted this onto their dental practice. I recommend certainly exploring who the provider is, how many they've done, and what kind of top complications they've treated with it. Let's look at how the oral device works though. The oral device basically takes an imprint of your bite, and as it does that, they make you a mouthpiece that essentially has a crank device on it that allows you to shift your jaw forward. If you look at my jaw, it's essentially by pulling the jaw forward and sleeping somewhat like this at night. Now, I know it can look uncomfortable and seem like some people may not tolerate it well, but a lot of people do. It's the concept of how it works is pretty interesting. Go back to the model and pay attention to my back finger here. When I pull that jaw forward, it actually opens the airway. And that's how these oral devices work. Again, some people do complain about jaw problems or discomfort in their teeth or alignment problems in their teeth after prolonged use, but I've had several patients that have done well with it. Now, my background is both in medicine and in surgery from all the years in the Navy, but I've always been about, if you can fix it, it's better to fix it than it is to put a Band-Aid or a pill to it. So I was on the journey to try to figure out what can be done to correct the sleep apnea on a long term without having to wear a device at night. I went through several different procedures that are popular and out there, the UPPP and several others that are performed in the operating room, but ultimately I landed with this procedure because of its success and because of its ease. This procedure is called radiofrequency ablation of the base of the tongue, RFA of the tongue for short. It's been around for about 6 or 7 years. It's FDA approved. Initial studies as it launched were that it got about a 50-50 chance of taking care of your sleep apnea. And for a lot of people that didn't seem too strong. But in the world of surgery for sleep apnea, it was still better than the UPPP, which a lot of specialists only quote a 45% cure rate with. The nice thing about this is simple, it's done in the office, and it's actually more effective than the 50%. I trained under a gentleman out of Georgia who has been doing this for a long time and has actually perfected the technique that in his studies he is getting 88 to 90% response rates with this procedure. It's actually pretty simple, and I'll go through it now for you. When you look at the procedure, RF ablation of the base of the tongue, it's done under a local anesthetic. It's done in the office, and it's basically patients drive themselves in and they drive themselves home. So there's minimal to no time off of work, and recovery is pretty quick. Let's look at the procedure. Basically, if this is the tongue, and this is the back or the base of the tongue where those really large taste buds are in the back, 2 injections are given in the base of the tongue to numb the tongue. I know that can sound kind of anxiety-provoking for some people, but it's a very well-tolerated process. To date, this is approximately August of 2017 right now. I've done about 800 of these procedures. And to date, I have not had a single person get off my table and say, oh my gosh, that was horrible, I'd never do it again. Everyone gets off that table and says, that's a lot easier than I thought it would be. Cool, we'll see you in 4 weeks. And I'll explain what that means in a second. So basically, once we get the tongue numb with a local anesthetic, same stuff you get at the dental office, we do the procedure. The procedure only takes about 3 minutes of time. That's how quick this is. Majority of time is really spent preparing, setting up, breaking down, sending you home. For the procedure itself, once the tongue is numb, we actually start at the base of the tongue. 2 tiny probes, skinnier than most needles, go into the tongue, and they go into a depth about what you see right through here. Once the probe gets into place, if you imagine this being the surface of the tongue, that probe gets into place, it generates radio waves. Radio waves generate heat, and that heat causes contraction of the tissue right around it. So you can imagine that probe in place causing the tissue to contract right around it. We're shrinking the tongue. If we shrink the tongue and the tongue is smaller, it's less likely to fall back in the throat at night. Now, that's not the only reason why this works. If that was the only reason why this worked, you're going to get the 50-50 chance of this working. Instead, my mentor who trained me showed me a way to take it to the next level. And the way we do that is that it's working on such a small area in the tongue, one treatment by itself is not going to be enough. We actually have to do 5 treatments. Each of those treatments is separated by about 4 weeks to give time to recover and heal. Now, most people have it done on a Friday, and by Monday they're back at work 100%, no problems. Some people even the very next day are at 100%. But we wait 4 weeks to allow that area that was treated to fully contract down. Now go back to that little analogy of the surface of the tongue, and we're treating down deep. That's treatment 1. It actually shrinks and contracts down. Treatment 2, and this is the critical part, we actually attach right to treatment 1, and it contracts down over a 4-week period. And we go through a series of 5 treatments. So not only are we reducing the volume of the tongue, but you got to think about that treatment area like a 5 boxcars on a train actually shrinking and reducing this way as well. If you go back to the original model and you see this area of treatment, if you imagine that contracting down and getting smaller, it's actually helped pulling the tongue forward as well. So it helps pull the tongue out of the airway by shrinking it and by pulling it forward. To date, out of nearly 7,000 cases done amongst the providers that are using this exact technique, we have not had any problems with long-term change in voice, swallowing, taste, or salivation. We've had some short-term disruptions, and some people saying for a few days to a week even, they felt a little tongue-tied because their tongue was swollen, but no long-term complications with it. The one thing we always worry about, but to date I have not seen, is an infection. Like I said, have done about 800 cases to date. I've seen 0 infections. My mentor, who is absolutely genius on this, has done 6,000 of these cases, and he's seen 3 infections. They're rare. We watch out for them. We're aware of complications, although they're rare, and we are capable of handling them should they come up. A lot of people will ask about insurance coverage, and I will tell you, from the date of making this taping to it actually you viewing it, changes are always happening because more and more insurance plans are covering this. All I would say to that effect right now, we're seeing great coverage with Medicare, Medicare Advantage, Blue Cross, and a lot of other commercial insurances. Call our office to get the latest list of who's covering it and how. We do these videos basically to give our patients an opportunity to learn more about the procedures, whether it be through our website or in the office at a consultation, and we're certainly available to answer some questions.
About 5 years ago, Dr. Powell had me do a sleep study test, which ended up on me being fitted for a CPAP. I was excited that maybe I would be able to sleep all night without alarming my husband that I was going to die or stop breathing on him and wasn't going to wake up. The CPAP machine lasted 2 days. The second night, it ended up across the room, and I never put it back on. So one visit I was having with Dr. Powell, he was asking me about my sleeping and told him it was about the same. I wasn't. I've had some health issues in the past, been diagnosed with COPD, that affects my sleeping at night because it was hard to breathe. When Dr. Powell first talked to me about this procedure, I was a little leery of how this could change my sleeping habits or make me feel better. So the first appointment, I was a little bit apprehensive, and the staff was amazing in preparing everything. They told me that I would probably experience some pain and that if I wished I could have pain medicine afterwards. They give you a popsicle. That's the number one best thing of the whole thing, is you get a popsicle. I always thought you got a popsicle after your procedure, but this one you get a popsicle before the procedure. You go into a room, Dr. Powell is right there with you through the whole time and talking to you of how this is going to be and encouraging you it's not going to hurt. When it was over with, I asked him when we were going to begin the procedure. That's how easy it is. The procedure has changed my life in many ways. The first one that comes to mind is I'm sleeping all night without going, and gasping for air, or snoring so loud that we're blaming it on my dog, and it was actually me, and keeping my husband awake. I have lost weight because of getting more rest. And in the mornings when I get up, I am ready to go. I have more energy, I feel better, I'm not craving so much different kind of foods to get energy the next day. Running 2 businesses, so at my age I need all the energy I can get. And now, since I've had this procedure done, I don't find myself having to use my albuterol as many times a day or doing a breathing treatment. In fact, we just got back from Telluride, Colorado, and everybody was worried about me being in that high altitude of not being able to breathe. And due to this procedure, I'm convinced that I was doing better than everybody else. I didn't have any problem at that high altitude, and we were 10,000 feet up. So I'm convinced that this is what helped me so much. I never would have thought that a simple procedure as this could change my life so much. I just never would have thought it was possible, and was grateful. I guess the words are grateful that I was given this opportunity to have this procedure done.
During the consultation, Roz was in there. She was talking to me and everything, and she mentioned pain, but there wasn't that much pain there. And I just talked to her. I said, "Have you had it?" She said, "Oh yeah, I've had it." And we just laughed and talked about it. And when you're doing that, you don't realize the pain. It's no pain really. It's just in your mind that it might be, because they made sure that our tongue was kind of asleep, I guess, and Dr. Powell just went to work on it. Roz is a good nurse too, sitting right there beside him. I mean, they're a good team. The entire staff in Dr. Powell's office, they're awesome. They're here to take care of his patients, and they make sure that we're comfortable, and they offer us water. They're awesome. This procedure that I just did with Dr. Powell has changed my life. I go to bed at nighttime and I get a good night's sleep. I wake up in the mornings and I have a lot of energy. I can go out and work in the shop and just have energy. I don't get tired like I used to, and just it's a real good procedure. At nighttime I'd take some Tylenol PM and stuff like that to sleep. Now I don't take nothing to sleep. I've had people ask me about the procedure, and I said, yeah, you should have it because it will change your life.